Hey guys! In today's video, I'm going to be answering more skincare questions that I get a lot of times. You guys really seem to enjoy just this kind of casual, random skincare Q&A style video. And I'm throwing into the mix a Fabfitfun unboxing. This is not sponsored. Y'all know I'm a huge fan of the Fabfitfun box. I buy it myself. I've been getting it for a couple of years now. First question, what is the difference between retinol and DIFFERIN? Retinol is a cosmeceutical ingredient. It's a form of topical vitamin A, which when you apply it to your skin, in order for it to work, your skin has to convert it to retinoic acid. DIFFERIN, or adapalene, is not a retinol, it is a retinoid, and it is actually an FDA-approved medication for the treatment of acne. It used to be available only by prescription, but here in the States, you can buy it over the counter. In contrast to retinol, once you put it on your skin doesn't have to convert it to retinoic acid. It is already active. With a retinoid, whether it be prescription or over the counter, you're gonna see results sooner than you would with a retinol. Retinols tend to be less irritating, but that being said, adapalene, aka DIFFERIN, is one of the gentlest retinoids out there. Ooh, opening her up. Win a 5-day all-inclusive trip. I could go for that right now. Second question, tips for preventing varicose veins. Varicose veins are really common in people who stand a lot. They can pop up during pregnancy. Hormones contribute to their formation. If you're on oral birth control pills, that can, kind of motivate them to appear. And of course, genetics. One thing that definitely can help is wearing compression stockings. Not the most comfortable thing, but compression stockings, they reduce pooling of blood in the veins. And it's that pooling that kind of puts a lot of wear and tear on the little valves in the veins, and that's why you get bulging out of veins and varicose veins. You can be custom fit for them, and that's actually the best type. The Jobst compression stockings, you can go and get them custom fit for your legs. They also have some pretty good ones actually on Amazon that I personally wear from time to time. I haven't worn them in a while because, hello, Houston, it's miserably hot here. But that is something that you certainly can do to prevent their formation. It doesn't guarantee they won't form, but it reduces the formation. Now, if you have varicose veins, the treatment to get rid of them is sclerotherapy. I'm gonna link down below in the description box my video on varicose veins where I go over sclerotherapy. But that being said, if you do pursue sclerotherapy for your varicose veins, part of the recovery is to wear compression stockings. Here's the first thing, something from Coach. Ooh, aren't these pretty? Oh, I'm excited for those. It's a set, earrings and a necklace. They're so pretty. I really love those earrings in particular. Yeah, I always get an article of jewelry in this box and I wear it. I'll wear the jewelry a fair amount. Last season I got this little lemon like plastic plate thing. I eat off of that like every night. Anyways, all right, what was the next question? Anything you would recommend for hormonal acne? Now I get this question a lot. When it comes to stuff that you can do as far as your skincare routine for hormonal acne, there's nothing unique outside of the regular acne treatments. Retinol or retinoid, DIFFERIN for example, salicylic acid, benzoyl peroxide, azelaic acid, the topicals, there's nothing unique that you can buy in the store for your skin for hormonal acne that differentiates it from other acne treatments. However, typical acne treatments, they don't address the hormonal component of hormonal acne. That's going to be medical therapies with prescription medications. The combination of spironolactone plus birth control pills, they hit different arms of the hormonal signaling pathways that lead to upregulation of sebum production and oiliness. Many people who deal with hormonal acne have an underlying condition called PCOS, probably heard of it, and that can be accompanied by other things like female pattern hair loss, hirsutism, which is hair growth in a male pattern distribution like on the face or chest. And those issues likewise can benefit from this combination. The other thing though that you can do proactively that has nothing to do with skincare products is managing your diet and lifestyle factors. Make sure that you're not eating a lot of processed sugary foods. Remember from my video on the clear skin diet, high glycemic foods that increase insulin, that's gonna increase insulin-like growth factor, lead to more acne. Likewise, there's an association with skim milk and hormonal acne flares, the hormonal component of acne at least, by increasing insulin-like growth factor, which drives sebum production. That's not to say you can't consume dairy, but pay attention. If you consume a lot of dairy, you find your skin gets worse with dairy consumption, that's definitely something to dial back on and see if it helps. And then take a look at dietary supplements that you might be taking, because some dietary supplements are associated with acne. Whey protein, biotin, a lot of people report biotin causes acne flares. High levels of vitamin B12 have also been associated with acne. And iodine. So if you eat a lot of kelp, seaweed, and you find that's aggravating your acne, it could be the iodine. You got a Green Chef coupon. I love Green Chef. Really a good one. Green Chef, purple carrot, and there's one other one that I really like a lot. I was getting those for a while there. They're really convenient, those meal prep delivery kits. There's one really bougie one that a lot of people talk about called Sakura. I've heard about it for years now, and I've always kind of been tempted, but it's really expensive, and it's like, I don't know. I'm pretty self-sufficient when it comes to meal prep, but that one always has caught my eye. All right, another common question that I get is, does tretinoin cause lung cancer? No. You know, there was a study several years ago and done in the VA that reported an increase in all-cause mortality amongst veterans who happened to be using tretinoin. But when they delved into the research, did meta-analyses, I mean, there's no plausible explanation for that. And it was one of those things where guilty by association. Those individuals had other risk factors and comorbidities for increased risk of death, basically. So no, I mean, you have to be, when it comes to science, when it comes to studies, you have to be very careful about how you interpret them. And this is a problem, actually. Now that there is so much more, now that science and publications are so much more accessible than they were in the past, people get a hold of them, they react to the title, maybe the abstract, they don't actually read the study, or maybe they lack the skills to interpret the studies correctly, and then the media gets a hold of studies, misrepresents them, sensationalizes a headline, and causes fear mongering. So that's really a problem that, you know, I mean, you could find a study out there probably saying that, you know, chewing gum is associated with an increased risk of, you know, bad breath. But people who have bad breath probably chew more gum to help their bad breath. People who chew more gum, people who have chronic dry mouth are more likely to have halitosis, bad breath. They're more likely to chew gum. So you have to be really, really careful when it comes to studies. They can easily fearmonger. Okay, I definitely did not request this because y'all know I don't consume alcohol, but this is adorable. It's a mini Heineken. That is so cute. That vegan cookbook that I shared with you guys in my favorites video that I got from the library, there was actually a recipe in there that called for beer. Oh, we have another article of jewelry from Jenny Bird. I really like Jenny Bird jewelry. And I've gotten another piece of jewelry from Jenny Bird in my Fabfitfun box. Yeah, it's like a layered necklace that I wear a fair amount. Ooh. Oh, I think this is like a bracelet. Yeah, this is a bracelet. It's like a bunch of different chains. Ooh, I really like that. The next question I get is, does hyaluronic acid actually work in skincare products? It does. Well, you have sodium hyaluronate, which is a salt of hyaluronic acid. You also have hydrolyzed hyaluronic acid, and it acts as a humectant. So it just kind of helps increase the hydration status of the top layer of the skin. And that's actually really important. The moisture levels in the top layer of the skin are important for the function of the skin barrier, for enzyme function. And when the skin becomes dry and dehydrated due to barrier impairment. You lose more water and things just kind of start to go awry. You become more prone to irritation and then symptoms of sensitivity. Hyaluronic acid in a properly formulated moisturizer can help in increasing the moisture content of that top layer of the skin. But when it comes to using hyaluronic acid on its own, you have to be careful, because if you just use it by itself, yes, it will help pull water into that top layer of the skin. But if there are no occlusive ingredients with the hyaluronic acid or layered on top, then that water will just evaporate out of the skin, and it'll end up pulling more water out of the skin, leading to more dryness. The other thing you have to be careful of when it comes to hyaluronic acid is that it does increase penetration. It increases penetration of other ingredients. So you may find that ingredients become more irritating. You're more prone to irritation with hyaluronic acid. So getting back to your question, yes, hyaluronic acid can work in skincare products. It's also been shown to improve healing. So it definitely works. Ooh, this is another thing. I frequently get chews in my Fabfitfun boxes that always is a win, and that is socks. This is by the brand Fry. These are bamboo socks. Yeah, bamboo is a nice material. It's really breathable. Speaking of socks and footwear, I get a lot of questions about foot fungus and toenail fungus, tips, tricks, etc. Now, stuff that you buy over the counter to treat toenail fungus or foot fungus, truthfully, they really don't actually usually end up working to treat the fungus. I mean, it's rare that it actually will treat the fungus. They're not, specific enough. And the other issue when it comes to toenail fungus is actually getting the medication to penetrate the nail. That is definitely a challenge. If you're coping with these things, you have to rein in some of your lifestyle factors as far as how you care for your feet. Make sure that you don't stay in sweaty socks. Change out your socks frequently. Keep your toenails clipped short, because the longer the toenails, there's more real estate there for fungus to glom onto. And then consistently using a urea-based foot cream can really help a lot, because it softens and exfoliates dry, built-up, shedding skin cells, callus. It improves the moisture barrier of the skin, reducing the risk of fungal colonization, not only in the feet, but also in the nails. Anyways, I'm pretty excited about these boot socks. They look comfortable. Ooh, I got a hair mask. I think I did pick this. It's vegan, it's a hair mask. Speaking of hair, question on Botox for hair loss. What do I think about using Botox to the scalp for hair loss? It's not going to regrow your hair or anything, or make it, it's not going to be like the treatment, but it is compelling. In fact, some people are actually getting some good results with Botox in conjunction with other conventional hair loss treatments. And the thought process is that it may actually, improving circulation and blood flow to the scalp can help cut down on dihydrotestosterone, basically the conversion of testosterone to that more potent dihydrotestosterone. Anything that improves circulation to the scalp may help in reducing DHT, the more potent form of testosterone. Remember, testosterone, which both men and women have, gets converted to DHT, and that causes miniaturization of the hair follicles. You get that baby hair, which makes you look bald, and that's why you get pattern hair loss. Men often have receding hairline. Women, it's going to be a widening of the central part. There is some thought that Botox, because it relaxes the muscles, it may allow for better circulation, and ultimately might reduce DHT levels in the scalp. And yeah, there is some rationale behind Botox for the scalp. Botox in the scalp is also a treatment if you have hyperhidrosis, excessive sweating of the scalp. Many people will go for Botox for that. We'll get Botox for that. You just have to be careful, because sweating is a good thing, even though it's a burden. It helps cool the body. Then a question that I commonly get asked is, can I do a skincare routine for teenagers? I have to tell you guys, the same basics apply to teenagers: cleanser, moisturizer, sunscreen. So for teens, I do recommend just a basic cleanser, a moisturizer, or sunscreen. I mean, check out my videos on any of these types of products. You don't have to, they're not necessarily age specific. Now, if you have acne, Of course, there are the typical over-the-counter acne medications, salicylic acid, benzoyl peroxide, DIFFERIN. I mean, these are all appropriate for teenagers with acne. But if you're a teenager with acne and you've been trying these things and it's not responding, you definitely want to see either your pediatrician, your primary care doctor, have them refer you to a dermatologist if necessary, because there are prescription topical medications and oral medications that in many cases can provide almost complete clearance and even a cure in the case of Accutane. Isn't this beautiful? This little enamelware pot. I get the best kitchenware stuff on Fabfitfun. I wonder if this can go. Made to withstand temperatures and dishwasher safe. Winning! This is gonna be great to make little soups and things. You also can get add-ons, and I chose this because I've been really into these little, you guys know I make my slow cooker apples, and I've been making that vegan cheese. And I've really been into doing little apple and cheese wraps in a tortilla. So I got this, it's by the Phantom Chef. It's a fry pan, non-stick fry pan. I thought it had a nice handle. Just a little, I thought this would be perfect for tortillas. It's like exactly the right size. This particular box was 100%. Everything in this box I am down for, I'm excited for, I'm gonna use. Speaking of used from the Fabfitfun box, I had on my robe earlier before I sat down to film. I got this robe, was it a year ago? I feel like I got this last year in the fall box, and you know, you've seen me wear it over and over again. It's got a little hood, yeah. This was one. That blanket back there, I got in a Fabfitfun box. I told you about the plate. What else? There's this little urn that I have to water my plants. Yeah, I'm telling you, it's definitely been a worthwhile investment for me to continue to get this box because I use everything that I get in it. I hope you guys enjoyed this kind of casual Fabfitfun Q&A. On the end slate will be my last just kind of random skincare Q&A if you want to check it out, see what I answered last time. But if you like this video, give it a thumbs up, share it with your friends, and as always, don't forget, sunscreen and subscribe. I'll talk to you guys tomorrow. Bye.